We get a lot of questions this time of year about the best way to contact patients about unscheduled treatment. So let me show you a really useful report in Open Dental. We want to go to Reports and then Standard and then the Treatment Finder report right there. This report takes just a little while to load, but once it does, you have a list of all the treatment plans that you have put in Open Dental that for patients who do not have appointments. But we can massage this list a little bit and make it even more useful. One thing we can do is go up here and include patients who do not have insurance. Now, at this time of the year, we're primarily concerned with patients with insurance, but other times of the year, we want to include those people who don't, so we would check that box. The other thing we can do is limit the dates of the treatment plans, because it's more likely that we'll get a response from people on more recent treatment plans than treatment plans you did 5 years ago. So we can just look back. In this case, we'll just look back at treatment plans we did this year and put that in there. Don't forget to hit the refresh list button there so that it will update the list. So now we've got a whole bunch of treatment in there. And depending upon how much time you have to call patients, this may be a little bit overwhelming. So we can go in and narrow our list a little bit more, maybe target specific treatment plans. And we can do this by narrowing the code range, just like we did with people with or without insurance, and like we did with the date. We can narrow this to specific procedures. And so crowns are usually a pretty good thing to search for. And we can search for a range of procedures. So if you do porcelain crowns and porcelain to metal crowns, you can put the range from a D2740 to a D2750. And again, narrow our list a little bit. So don't forget to hit the refresh button so we update our list. So boom, now we have a list of all the treatment plans that contain either a 2740 or a 2750 in the treatment plan. They may have other treatment as well, but at least they've got the crown in the treatment plan. Now we look at these and say, well, that's really not very many patients, so maybe we want to cast a little wider net. Maybe we want to go back one more year. So I'll go up and change my date range up there, and then hit the refresh button again. And now I've got a bigger list, more people to call. Again, these people also have insurance benefits that are expiring at the end of the year, usually. They have crowns in their treatment plan, and none of these treatment plans have been scheduled yet. So this is a pretty good list. I went back and probably the more recent ones are going to be easier to get in, but I've got a little wider range, a few more patients to call. So what am I going to say when I call these patients? What are my verbal skills? Well, that's the nice thing about crowns is people already kind of understand about crowns. You call a patient and you say, gee, Mrs. Jones, we were just thinking about you today. And I know you've got insurance. It's kind of nice that you were thinking about Mrs. Jones. I know that you have insurance that is going to expire here at the end of the year. You're going to lose, let's see, say $1,000 of insurance benefits if you don't use it by the end of the year. And Dr. Piccinini has recommended that you have some treatment done. I just wanted to call and see if you had any questions about that. So you're asking the patient if they have questions. This may elicit the objections. Why hasn't that patient scheduled already? And if we can find that out, maybe we can deal with the objection and go ahead and schedule the patient. And particularly, you're calling now because they've got this $1,000 in benefits they're going to lose. So coach things in terms of what benefits the patients. And they're losing the insurance, and you want them to answer any questions that they have. So again, this is a pretty effective script to use with people on this list. Now you want to go to the account that we look at in just a second here, so you're familiar with the treatment plan and the insurance benefits before you call the patient. So that's great, but what if I want to look at treatment other than just crowns? Well, you can go up here and you can put in any range of procedure codes you want. What if you're interested in implant-related treatment? Well, we can put the whole range, those are the 6,000 codes, so we can put the whole range of 6,000 to 699 up there. We'll go and refresh our list again here and see what we get. So now we've massaged the list a little bit more, so we have a list of all the treatment plans that contain, doesn't mean they're exclusively, but contain implant-related procedures. Now, with this group of people, it's probably very important to address how they're going to pay for the treatment. If you didn't do it when you presented the treatment, now's the time to go through the payment options again. This is extremely important to make the treatment comfortable for the patient. And so get your ducks in a row here before you make your phone calls. I think the most productive way to use these lists is right from the computer rather than printing them out and come back. Now watch what happens in the background when I click on a patient there. When I click on that patient, the new patient is loaded in the background. And I can either go to the family or the account, or I can simply minimize this list and it stays active, and I can go look at those patients, make notes and so forth. Make sure you do make notes in the CommLog when you talk to people. So what have we done? We've used the treatment finder list in Open Dental and then massaged it by changing the date range and by changing the procedures that we want to search for, to create a list of patients to call, particularly at this time of the year when they're going to lose insurance benefits here pretty quick. And in order to get them back in the office, get that treatment booked in the office. So this is a very effective thing to do at this time of the year, at other times of the year too, but particularly right now. And Open Dental makes this quite easy for you. Don't forget your verbal skills. We were just thinking about you, Mrs. Jones, and I know that you have insurance benefits that are going to run out here at the end of the year. I wondered if you had any questions about the treatment that Dr. Piccinini suggested for you. And then shut up. Okay, so hopefully that's kind of helpful and puts you on the right path here to get some of those patients in your appointment book instead of on the unscheduled list.